দীপানিতা একবার চেক করে নিতে চাইছি যে স্লাইডটা শেয়ার হচ্ছে কিনা।
আচ্ছা ম্যাম, আপনি একটু শেয়ার করুন, আমি দেখে নিচ্ছি।
ওকে।
হ্যাঁ ম্যাম, দেখা যাচ্ছে।
দেখা যাচ্ছে তো? আমি একটু ইয়ে করছি, স্লাইড চেঞ্জ করছি, একবার বলবে যে সেটাও ভিজিবল কিনা। ফুল স্ক্রিন দেখা যাচ্ছে তো?
হ্যাঁ 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 হ্যাঁ, চেঞ্জ
স্লাইডস
হচ্ছে ম্যাম।
ওকে,
হ্যাঁ হ্যাঁ,
থ্যাংক ইউ।
thank you. So good evening everyone. On behalf of NutriWorld, I am delighted to welcome you all to this special sessions on occasions of World Hypertension Day. We are honored to have with us today distinguished guest speaker, Ma'am Bijoya Madam. আমাদের সকলের প্রিয়। She is the assistant professor and head of the Department of Dietetics and Applied Nutrition at Amity University, Kolkata. And she is also the estimated founder and consultant dietitian at RB Diet Clinic and driving force behind RB Wellness and Nutrition Academy. তো ম্যাম, ওয়েলকাম আপনাকে আমাদের নিউট্রিওয়ার্ল্ড এর ফার্স্ট। আপনাকে আমি মানে আপনার সাথে যখন কথা হয়েছিল, মানে আপনি এমনিতেই আমার রোল মডেল, এটা আমার বলতে কোনো অসুবিধা নেই। মানে আপনাকে দেখে আমি প্রচুর কিছু শিখি। তো আমার মতন এখানে যতজন আছে, আই থিঙ্ক সো। থ্যাংক ইউ ফর জয়েনিং মাই সেশন।
Thank you so much, Dipanita, for this kind introduction, and I'm really, really happy to be here in your this endeavor. I can see a couple of the known names that I can see over here, but one thing, the way you have said that you really admire me, the way even I too, it's a mutual. I think I really appreciate your hard work, the dedication that you are putting into at such a tender age. আমরা না যে বয়সে এসে করছি, you have started it so early. So I can see a very bright future for you ahead, and you are already doing brilliantly well. I really, really appreciate that.
Thank you so
Thank
much.
you so much for having me here, and I would say for giving me the opportunity to be in your platform today.
Thank you.
Good evening, ma'am.
Good evening, Devushree. How are you?
ভালো আছেন ম্যাডাম?
ভালো আছি, ভালো আছি।
অনেকদিন পর আপনার সাথে কথা হলো, আর হচ্ছে যে খুব ভালো লাগছে। আমি নিউট্রিওয়ার্ল্ডে দীপান্বিতার সাথেই আছি। আজকে আমাদের সাথে আপনাকে পেয়ে ভীষণ ভালো লেগেছে, খুব আনন্দিত আমি। আমি আমার সমস্ত স্টুডেন্ট যারা এখানে আছে নিউট্রিওয়ার্ল্ডের, আমি তাদেরকেও বলবো যে ম্যামের কাছ থেকে শেখার মতন মানে শেষ কোনো বিষয় নেই। ম্যাম যে কোনো জিনিসে আমাদের সমস্ত কিছু শিখিয়ে দিতে পারেন। সবাই আজকের ওয়েবিনারটা খুব মন দিয়ে এনজয় করো। আমি তো এখনো শিখছি, ম্যামের সব ভিডিও থেকে আমি সবসময় শিখি, আমি ভবিষ্যতেও শিখবো ম্যাম।
আমিও কিন্তু নিজেকে সবসময় একজন ফরএভার স্টুডেন্ট বলি, বিকজ আই এনজয় মাই দিস প্রোফাইল অফ ফরএভার স্টুডেন্ট। দ্য মোমেন্ট এটা মাথায় এসে যাবে আমি শিখে গেছি, আমি অনেক জেনে গেছি, জানার পরিধিটা কিন্তু শেষ হয়ে যাবে, আর তো খিদে থাকবে না। তার জন্য অল্প অল্প আমরা যখনই খাই ভাববে যে অল্প খেয়েছি, আরো অনেক খাওয়া বাকি। তো কিপ ইউর হাঙ্গার লাইফ। বিবেকানন্দ বলে গেছেন, স্টে হাঙ্গ্রি স্টে ফুলিশ। এতে অনেক বেশি শেখা যায়, সবার সাথে ভালো থাকা যায়, শেখা যায়। তো আমিও সবসময় শেখার একটা ইচ্ছে করি। একটাই জিনিস জিজ্ঞেস করে নেবো, এখানে কি সবাই বাংলা নাকি এখানে ইংলিশেই আমি আমার সেশনটাকে নেব? দীপানিতা।
ম্যাম, ইংলিশ হিন্দি মিক্সড করে করলে বেটার হয়, মানে অনেকে আছে
ইংলিশ হিন্দি। তাহলে আমি ফুল অল থ্রু ইংলিশে যাচ্ছি তাহলে, ঠিক আছে? I think it is easier for people, and I'm not going to use any jargons, so it's going to be a very absolute scientific thing, scientific words which probably you all are aware of. So this topic that Dipanita has brought into itself is very, very crucial. The reason being, we all know that how much important the hypertension is, and I'm really thankful to Dipanita for bringing this topic, because even this is my own research area and research paper also, that is hypertension. Although my practice area is gastro and liver, but my research area is cardiac, so it's that way. Talking about the hypertension, although before I present my slides and all, I'd just like to ask, because I like to keep my sessions a little interactive. Do you think that cardiovascular disorders are preventable? Yes or no? You can use your chat box and you can use your, you can unmute probably if Dipanita and Devashree permits, then you can unmute and you can say. Cardiovascular disorders are preventable. Yes. Many of you are saying yes. Well, thank you. So I got my answer. So just a second. Gate রাখো, আমি পড়ে যাচ্ছি, সেশনে আছি। হ্যাঁ দিয়ে দাও। Okay. So Dipanita, just give me a minute. Okay. So as I was saying, E1000 So as I was saying, that this disease is preventable if your genetics are not involved. So basically for the hypertension, being hypertension is an awareness month, like we need to aware people. So our main focus is to work on the modifiable factors. So if I really talk about the risk factors, they are basically broadly categorized into two parts, modifiable and non-modifiable. Any idea about what are the non-modifiable risk factors? Non-modifiable means that you cannot change. Okay, so the non-modifiable factors are not being changed. So how you can change or how you can prevent that? So this non-modifiable factors can be prevented, maybe not in this generation, but can be taken care of for the upcoming generations. How? So because if you are healthy, if you are very active, so if your thrifty phenotype can be underrated, if your thrifty phenotype can be diminished, or if we do not let your thrifty phenotype to be active, then in that case, it can prevent our lot of disorders. And because of the sedentary lifestyle, generations after generation, this thrifty phenotype has been activated. As a result, if you see this young population nowadays are so much with hypertension. I mean, in my clinic, in my university, probably Devashree will also agree with me. If she checks the blood pressure of our students, most of you are going to come up with a very high blood pressure. And unfortunately, many of you are not even aware. So today's topic, I try to keep it from both the pharmacokinetics part and as well as from the dietetics part, because being a dietitian, being a nutrition student, it is equally important for you all to know that what are the medicines that are being given and what are the side effects of these medicines. Because if you see a patient has come to you and if you do not know about the medicine that has been given, you won't be able to do the further treatment. So without much ado, I'll start up with the presentation. Well, so in this today's hypertension awareness, what I thought of to deliver my lecture on is diagnosis and management of hypertension. Now, this management of hypertension diagnosis is also very important to know that how to figure it out. I'll just share a case study with this and will tell you that how important it is to diagnose hypertension even. And probably that is the reason the International Society of Hypertension has started up with the May measurement month. So they have dedicated or have given a guideline that entire month we should keep on checking your blood pressure. And this time, even for the World Hypertension Day, that is the theme also, that you need to check your blood pressure, right? So that itself is the first stage of diagnosis, because there are few signs and symptoms which often gets neglected, because people think that if I'm having or because it is beyond their imagination that if at all they are having hypertension or not. It is beyond their imagination. So due to that, this hypertension is also known as silent killer. Okay, so what is hypertension? Firstly, the systolic blood pressure has to be greater than or equal to 140 mmHg, and the diastolic blood pressure is 90 mmHg or greater. And if they are taking antihypertensive medication. Now here, I would like to tell you something that last month, a patient came to my chamber. So she came with her husband. Her husband came and he was saying that she does not have any problem. You just need to make her reduce weight. They were non-Bengalis, but I am the one who is having a lot of health issues. So I need to take care of my health because so and so issues are there. I said, okay. So I made them seated the way we do in our chamber. Then I was observing the lady and I was seeing that she was getting little restless. Okay, now the first sign is restlessness. If there is some uncomfortability, if your blood pressure is high, there is anger, there is restlessness. Probably they are not being there in any books or anything, but yes, these signs and symptoms do present in any hypertensive individual. Also the forehead sweating, this area sweating. It is also evident that many people do develop this area sweating. And if you see them, please make them sit and check their blood pressure, and probably you are going to see that their blood pressure is high. So that lady, after some time, she was saying that, I said that let me start with the lady, as she's just, you were saying that she is only having obesity. So I think her case is going to get sooner, because I was suspecting something else. She was 124 kgs. And I was seeing into her eyes, I saw that as if it was getting drooped. It was looking very tired, and she was not in her usual self. So I asked her that, are you having any problem? Then she said that I'm not feeling well and I have spondylitis, so I have neck pain. I said, do you have this pain in these areas as well? She said, yeah, I have spondylitis, so that is the reason. I said, okay, because this is another sign that is, you won't be finding it in the textbooks, that even the neck pain and the neck stiffness from this area, if the pain comes to this area, this is also an indication that your blood pressure is elevated. So probably your blood pressure is elevated at the carotid artery, and that is the reason this headache, this neck pain, these things are happening. So then I asked her that, she said that humko chakkar aa raha hai, I'm feeling giddy. I said, okay, no problem, you relax, sit, let me check your blood pressure. When I checked her blood pressure, it was 220 by 130. Fortunately, she did not have cardiac arrest. And I was like, are you aware that you have such high blood pressure? She said, no. And her husband was like, she was almost fainting. And her husband said that, shall I take her to the hospital? I said, it seems so, but wait. Immediately, now these are few things that all of you should know. As we are talking on the hypertension awareness, so you should all know for your household family members as well, or you can also maybe educate it to your patients. Because we, as a dietitian, as a clinician, we should not keep our knowledge or our experience with ourselves, but we should share it with everybody. Immediately, I gave her cool dog, that is the ice. Here, this region, it is the region which is just at your back of your head, this particular joint. So that reason I put the ice, and immediately I had banana and tomatoes. I gave her one banana and one tomato. The reason being, there is sodium retention in the body. That's the reason blood volume has been elevated. Okay, why there is hypertension? When the blood volume is elevated, there is greater than the blood volume that is supposed to be there in the body. As a result, that blood volume is exerting lot of pressure, lateral pressure on the walls of the arteries. Okay, so this blood volume, when it is elevated, it creates a rise in the blood pressure. So due to that, I had to give her potassium rich thing. Why? Because by giving more of potassium, sodium and potassium both are plus charges. Na plus, K plus, they cannot be together. And as they cannot be together, so more the potassium would be given, sodium will go out. So after giving that, another point that she said that I forgot to mention, that I do not get my urination very easily. And even if I feel urinate, it pains in my bladder area. And I have to sit for a longer time in the toilet to get my urine released. This is also a problem with hypertension, because when your blood pressure is high, it is not just high in your major arteries, but it is equally high in your microcapillaries. Due to that also, sometimes patients do feel like this kind of symptoms. So I said, no problem, you go. And because of our obesity also, our bladder was not being able to getting the reflexes. So after giving all these things like the birth, the eyes, then the banana, the tomatoes and all that, after giving that, and after making her sit, and I also wet her head. Okay. Then I made her sit in my chamber. I said, okay, and she was sitting quietly. After some time, she said that, I said that, are you feeling like to go to washroom? She said that, yes, I'm feeling like but then she said, I'm not going to have it. I said, throw it out of your mind, go to washroom. If you are not feeling like that, it is not coming out the urine, give a pressure to your bladder and you urinate. And then she came after some time from the washroom and then said, ma'am, lot of urination took place and I'm feeling better. I checked her blood pressure and it was dramatically down at around 150, 165 or 160 or 155, just like that. And the diastole was also at around 110. And then after some time, again, I gave her one banana, one tomato. I made her sit, and then her blood pressure went down further. So this was one thing that that lady could have gotten cardiac arrest in my chamber itself, probably, if I did not check her blood pressure immediately. So the checking the blood pressure is the first and foremost step to prevent this deadly silent killer disease, because it exhibits some symptoms which we are actually not very familiar with, I must say. So the types of hypertension, if I talk about, so there are essential hypertension, which has got no cause. I mean, 95% of the population are having this essential hypertension. And the secondary hypertension is those which are having certain causes like renal, kidney issues if someone is having, then endocrine, like the aldosterone hormone is getting secreted so much, and a lot of aldosterone is doing or taking lot of sodium inside the body. It is increasing the sodium reabsorption. It can be miscellaneous, like stress can be there. It can be unknown also, like if they have got it through the hereditary also. So how to classify this hypertension? So it can be classified. So we all know 120 by 80 or less than. It is actually less than 120 by 80 as per WHO is a normal. Pre-hypertension is a new classification that has been set in, that is 120 by 139, and diastolic blood pressure 80 to 89. So if any patient is coming to your chamber, do not wait for the nurse. You yourself check the blood pressure, and if you see that the blood pressure is in the range of 120 by 139, 120 to 139, and within 80 to 89, it's the high time that we should be careful about, and you start treating the patient accordingly by reducing the salt. You know, the most of the or the major reason for so high blood pressure nowadays is probably due to excess of the consumption of the UPF, that is the ultra processed foods, which are using preservatives like sugar and salt. Generally, we say that salt is responsible for the hypertension, right? But have you ever thought that what about sugar? Let me ask you this question to all of you. What about sugar? Any idea? Do you think that sugar can pose a threat or sugar can create some problem with the hypertension?
Yes, ma'am.
So, Momi, as you have said, how? Can you explain?
Ma'am, maybe the sugar can increase the density of blood, which can create any further problem. and I haven't any clear idea, but I think this can be a reason.
Okay, so you are going very close. This is one reason. Another thing with the sugar is, have you seen that after having sweets, your face become puffy? Have you seen that? I'm
It
talking about
attracts
the
water.
immediate. Hmm?
It attracts water.
Yes, because the nature of the sugar is hygroscopic. It attracts water. So sugar is basically hygroscopic in nature. It attracts water. The work that sodium is doing, the same thing even glucose is also doing. And that is the only reason why the ORS is also having glucose and sodium, because they help, first of all, they help each other as a co-transporter, without which the water cannot enter. So we are just blaming salt, but it is actually sugar also to be blamed for this increased blood volume, because sugar also attracts water. It takes up the water within the cells. Okay, that is also a problem. And another thing that some of you have written very correctly, that yes, sugar needs a lot of insulin, and that gets converted, and this hyperinsulin secretion can convert it to triglycerides, because insulin is lipogenic in nature, and converting it lot or converting or creating a lot of triglycerides is actually going to make the blood viscous, as Momi has said, which can also exert a lot of blood pressure, and it can also block the arteries, which probably can elevate the blood pressure. Okay, so coming back to the PowerPoint. So that is the reason in the pre-hypertension. So be very, very careful. And stage 1 hypertension is 140 to 159, wherein the diastolic is 90 to 99, and stage 2 is greater than 160, and the diastolic is greater than 100. So whenever you will see this kind of situation, so obviously only diet helps. I won't say that it does not, but it depends on the underlying condition. If they have got some critical medical condition, then in that case the medication and diet has to work hand in hand. Otherwise, a simple tip to all of you, please make the breakfast of the hypertensive patient salt free, and you will see, and add up potassium rich sources there, and you will see for the entire day the blood pressure is at pretty much normal level. So 25% of the urban population and 10% of the rural population are actually suffering from hypertension. So this hypertension is not just isolated in the urban area, but yes, it is affecting, it is taking the rural people also in its capture. And 70% of the all hypertensive patients are at the stage 1 hypertension, and 12% of all hypertensive, they suffer from isolated systolic hypertension, means they just have only systolic hypertensives there. So who are at risk? Although there are certain predisposing factors, advancing age, the more we age, but believe me, nowadays even the young stars are at a risk of hypertension, because of the lifestyle, because of the dietary pattern that they're following, because of the lack of activities, all these things. And even the children, small children, they're so piled up with their homework, they're so overloaded with their homework, that even they also go to sleep so late at night. Sleep is a very, very important factor in or as a predisposing factor in hypertension. Also the males and the postmenopausal women, family history if someone is having of cardiovascular diseases, also if someone is having sedentary lifestyle and psychosocial stress, smoking. Obviously we all know that smoking, what happens in smoke, there is nicotine is present in the cigarettes, and this nicotine is responsible for the vasoconstriction. It constricts the blood vessel, as a result it elevates the blood pressure. If the diet is rich in high cholesterol, or rather high saturated fat diet, to be precise, high saturated fat diet, because even the American Heart Association has said that cholesterol rich diet is actually not increasing our cholesterol level, but it is the saturated fat. And if someone's diet is having low fruit consumption, obesity and weight gain, let me tell you, banana is a magic fruit for hypertension. Firstly, especially if it can be given in combination with nuts like almonds, being omega-3 fatty acids rich. Then magnesium is there, and banana itself is containing so much of fiber, and it is fructose. Most importantly, it is having potassium, very high potassium. It helps to bring down the blood glucose level, blood pressure level. Also, if there is obesity and if someone is gaining weight persistently, then it is also a predisposing factor for hypertension. Then if there is some coexisting disorder, like if there is diabetes or hyperlipidemia or high intake of alcohol, if someone is having, then it is also a threat. So if the hemodynamic pattern, this is one calculation, like for the young, if the elevated blood pressure is, if the cardiac output is high, and if the into TPR, so that is how it is being checked for the, if they are hemodynamically stable or what is the hemodynamic pattern. So in the young people, the blood pressure, if it is elevated, then your cardiac output is also high, and multiply it with the TPR. So that is going to give you the result for the young and for the elderly. Basically, these are being done by the nursing team and by the medical team to identify the disease. So talking about the secondary hypertension, which is around 5% of the population who are suffering. So if they are having renal arterial stenosis, if they are having aldosterone hormone issues, if they have Cushing syndrome, if they have got pheochromocytoma, if they have got acromegaly, or if they are into some kind of OCPs, if they're taking glucocorticoids, some steroid medication, if they're taking, if there is hypothyroidism, and if there is hyperparathyroidism, all these things are leading to excess accumulation of fluid in the body. We all know for the thyroid patients, finger rings are stuck, face is puffy. Why? Because it is attracting a lot of water. And more the water volume, more the blood volume. Now, because water, when it is being attracted towards the body, when it is being reabsorbed in the body, so it is not just going into the cells or the interstitial spaces, but also it is going to your blood. So as a result, increasing the blood volume. So what is the cause of the systemic hypertension? It can be pregnancy induced, that is preeclampsia. You all have studied in pregnancy that if there is a PIH, that is pregnancy induced hypertension. Then it can be sleep apnea, if there is sleep disturbance, sleep apnea, if there is there, and if there is coarctation of the aorta. So if the aorta itself is getting constricted, that can also lead to the systemic hypertension. So why is it necessary to treat hypertension? Can we leave it? No. Because the diseases that are attributable to the hypertension are, like, it can lead to gangrene, yes, of the lower extremities, which is very important. Then it can lead to cardiac failure. It can lead to left ventricular hypertrophy. How many of you see the echocardiography reports? Do any one of you see the echocardiography reports? Do any one of you see? First thing that is going to help you to be a good dietitian is, don't just go by the prescription of doctors. I strongly follow this thing. I don't go by the prescription of the doctors. I have my own set of diagnosis. Along with that, the prescription of the doctors are going to help me. So the prescription of the doctors are very much important because it is going to be the guideline. But apart from that, even many of the times the diagnoses are even missed by the doctors also. So probably there your diagnosis can actually be a support system to that diagnosis, and then the accurate dietary management can be obtained. So if you really go through the echocardiography or the echo screening report, you will see these terminologies are there. The left ventricular hypertrophy means your ventricles. What does our ventricle do? All of you remember the anatomy of heart? We have the right atrium, left atrium, or right auricle, left auricle, right ventricle, left ventricle. So our auricle, it receives the blood through the superior vena cava, and it reaches, sends the blood to the ventricle. Okay, then therein we are having the tricuspid valve. So valve get opens, blood goes to the ventricles, then the valve, it closes like this because blood has got a regurgitation, it has got a backflow system. So your blood, it over the valve, it opens like a funnel like this. The blood, it goes to the your diastole, I mean to the ventricle. Then again the funnel, it closes like this so that the blood is going to give a big back thrust and it should not come back to the auricle. And then from the ventricle, through the semilunar valves, it gets open, and through the pulmonary artery, the blood goes to the deoxygenated blood, it goes to the lungs. From there, the lungs is mixing the blood with oxygen. I'm just telling you the nutshell of the anatomy because you need to know these terminologies. So the blood is getting mixed in the pulmonary, in the lungs, and then the pulmonary vein is bringing the blood to the oxygenated blood to the left auricle. From the left auricle, bicuspid valve opens, it goes to the left ventricle. Then again the valve closes like this, and then the blood, the valves of the aorta opens and the blood, it enters the aorta, and then it goes to the entire body. This is what is the cardiac cycle, right? So while talking about the cardiac cycle, this ventricle, they need to eject it, they need to press, they need to constrict, and then they releases the blood. Okay, so if the ventricles are failing, they are getting tired of throwing that much blood because so much of blood has come to the heart. So the ventricles are finding it very hard to throw it. As a result, your ventricle starts failing. That leads to the cardiac failure. So hypertension not just lead to cardiac arrest, but it also leads to cardiac failure. Okay. So that can lead to the left ventricular hypertrophy because your ventricles are receiving so much of blood, then it is not being able to do it. Then this persistent hypertension can lead to pulmonary arterial hypertension also, which is very bad because the prognosis of pulmonary arterial hypertension is very bad, and it can lead to COPD, it can lead to death in 5-6 years, not more than that. The quality of life goes down if not treated very early. Then it can lead to the other CHDs. It can lead to hypertensive encephalopathy because of the persistent high blood pressure. There can be cerebral hemorrhage. It can lead to encephalopathy of the brain, preeclampsia, stroke, kidney failure can take place. You will see because whenever there is hypertension, they get the hypertensive medicines, and because of the hypertensive medicines, especially amlodipine and all, although they are cardioprotective, but they are not always renal protective. They lead to the increased ACR. You know what is ACR? That is albumin creatinine ratio. So that if gets elevated, can lead to excess of the proteinuria, leading to the pedal edema, and then the patient can suffer from the renal loss also gradually. And too much of blood pressure can damage the arteries of the eyes, causing blindness. So the target organ damage with the hypertension is for the heart, left ventricular hypertrophy. It can be angina, that is the pain which develops in the heart and moves to the left side of your body. Myocardial infarction, heart failure. For the brain, there is stroke or the ischemic attack. It can be CKD, it can be peripheral arterial disease, means the arteries of your legs are being affected. Retinopathy, because your eyes are getting a problem. Okay. So what are the CVD risks? The blood pressure itself is a very strong risk indicator for the cardiovascular disorders. It's and it is independent. And pre-hypertension signals the need for increased education so that the blood pressure can be reduced, which can help further to reduce the hypertension. So diagnosis, generally for the clinical manifestations, if you'd like to see, no specific complaints. So that's the reason it is being said the silent killer. I already told you, and few of the clinical manifestations I told you. Another is morning occipital headache. After waking up, they are finding this headache here. This particular persistent headache, it is not due to stress. It is not due to migraine. It's not even due to sinusitis. If this headache is persistently there even after waking up in the morning, it is a sign of the hypertension. Dizziness, chakkar aa raha hai. Fatigue, feeling extremely tired, not being able to talk, feeling like something is there on the chest. And in severe hypertension, the vision can blur, leading to epistaxis. It is known as the epistaxis. So self-measurement of blood pressure is very important, and this is what is the theme for this World Hypertension Day as well, because this is going to tell you that if at all the medications that you are taking, if your body is responding to that. So response to antihypertensive therapy, then improving the adherence with the therapy, that how well you are following the medication and how well your body is responding to the medication. Then home measurement, if you see that the blood pressure is greater than 135/85, obviously it is hypertensive. So accordingly, the treatment has to be initiated, and home measurement devices are to be checked regularly so that they're not giving the errors. So systolic blood pressure, you all know how to measure the blood pressure. I believe you all are aware that whenever you are doing it in the sphygmomanometer, if you are putting the stethoscope, if the first, when you have given the blood, when you have elevated the blood pressure, and then when you are losing the knob, when the blood pressure starts falling down, I mean, the mercury starts falling down, not the blood pressure, the mercury starts falling down, then the first sound, first of two or more sound that is being heard is the systole. The first sound that is being started, dup, lup, that is the systole, and the point at which the sound disappears, also known as the Korotkov sound. So that is your diastolic blood pressure. So if the people who are hypertensive or who are at a stage 2 hypertensive, for them especially ambulatory BP monitoring is highly recommended, because in the ambulatory BP monitoring, it is providing the information of the blood pressure during the daily activities and even during the sleep, that what is the blood pressure. Also, it correlates with the other measurements which are associated with the target organ injury, like if there is some kind of kidney issues or if there is some kind of cardiac issues, that can also be addressed. So few of the laboratory tests are there that can be addressed too if you see a persistent blood pressure is high. Routine tests that include the echocardiogram, urine analysis to check if there is loss of protein, blood glucose, serum potassium, creatinine, or the corresponding estimated GFR, that is the glomerular filtration rate, and calcium, because too much of calcium can lead to the blood clotting, can also increase the blood pressure. Lipid profile, definitely to be done after 9 to 12 hours of fasting. That also include HDL and LDL. Remember one thing, LDL when gets oxidized becomes harmful, otherwise it is not harmful. It is interesting to know, LDL, we say it is a bad cholesterol, but LDL is harmful when it gets oxidized. So if you're taking too much of white oil, too much of PUFA, many number of double bonds are there that are prone to breakdown, that are prone to oxidation, putting your LDL at a risk of getting oxidized. So other optional tests that are to be done is the urine albumin excretion, as I was already telling you, the ACR, that is the albumin creatinine ratio, and more extensive testing for identifiable causes are generally not included, because if the blood pressure control is not achieved. So all these tests are to be done. So even for your patients also, there is no harm in asking for the test. You can very easily ask your patients to go for these tests. How to treat? So the treatment overview include that what is the goal of the therapy. So what exact therapy you're going to give. Most important is the lifestyle modification. Yes, the lifestyle has to be modified. Now, who is hypertensive, don't ask them to start running immediately. For them, yoga is the best form of workout. Okay, because that is going to bring down their stress. That is going to bring down their cortisol level. And that is not going to increase your blood pressure also. But if you start walking or running, that can elevate your blood pressure suddenly because of the sudden rapid blood circulation. So start with yoga. Pharmacologic treatment, yes. An algorithm for treatment of hypertension to be followed, and along with it, the follow-up and monitoring. So the goal of the therapy is to bring down the cardiac and the renal morbidity. So whenever the doctors also, they give medicine, they try to give you the renal safe medications. Okay. and their target is to bring down the blood pressure below 140 by 90 mmHg or below 130 by 80 mmHg if they are having diabetes and CKD. So in case of the diabetes and CKD, the blood pressure target is less than 130 by 80, and for the non-diabetes and non-CKD, the target is less than 140 by 90. So the non-pharmacological options that are being followed is first, DASH diet, immediately to be started, regular exercise, body weight to be lost if someone is obese, salt in reduction definitely to be done, and the harmful habits like smoking, alcohol to be avoided. So the lifestyle modifications include these things that I have already told you. Also, along with that, limiting the intake of the foods that are rich in the fats, saturated fats, and increasing the consumption of fruits and vegetables are definitely going to help someone with the hypertension. So the most important diet that is being followed or that is to be followed in hypertension is the DASH diet. In the DASH diet, as you can see, 4 to 5 servings per day, vegetables should be there. You always have to remember that in a DASH diet, it should be filling. One person should feel full because the diet should be rich in the fibers, that should be rich in lean protein, and it should be filled with low calorie vegetables. So this is one thing that is to be done. So 2 to 3 servings per day to be given fat-free or low-fat dairy, and 6 to 8 servings per day for the whole grains. Whereas nuts are also important because they're rich source of omega-3 fatty acids that is going to bring down your bad cholesterol, and also hypertension is associated with the low-grade inflammation, even the high-grade inflammation, because in obesity there is a release of the inflammatory markers called IL-6, IL-8. All these things do trigger your hypertension also because they elevate the CRP. Now, if the CRP is elevated, then inflammation is one of the potential cause of hypertension. So our diet should definitely be having fruits, vegetables, and nuts and fishes. So less than 6 servings per day for the lean meats, poultry, eggs, and fish, and less than 5 servings per week for the sweets, and 2 to 3 servings per day for fats and oils. So this is what the DASH diet is to be followed. Although this is an awareness webinar, so I'm not going much into details, but this is the thing that is going to help you to have a better understanding, because DASH diet to be started immediately. But whenever you will see a patient has come up to you and the blood pressure is too high, it is ranging around 150, 160, 140, first of all, stop their sodium for 1 day. Give them complete sodium-free diet. And you will see that, yes, and enrich the diet with the fruits. The Kepner's diet, if you all have heard, Kepner's diet really works in bringing down the blood pressure. At least for 1 day, you can do it so that the blood pressure goes down, and then you start with your dietary management, gradually put them into a normal DASH diet kind of a thing, which is going to help them with the better control of the blood pressure. So it has been seen by reducing the weight if someone is obese, but the problem is with those who are not obese, they are lean, but still they have the hypertension because there is visceral adiposity. Visceral adiposity means although they are looking lean, but they have a fat which is there inside their abdomen. In the abdomen, why the abdominal fat is the most difficult one to lose? Because the fat is there in 3 areas. What are these 3 areas? In the subcutaneous layer, in the ectopic region, okay, where it should not be in the organs, that is the visceral in the organs, and in the omentum, that is the cavity, the peritoneal cavity. There also there is a lot of fat. So there is so much of fat that losing so much of fat becomes very difficult, and that is the reason when start losing weight, reducing the abdominal fat becomes a very crucial one. Anyways, so talking about the weight reduction, it helps to bring down the blood pressure of 5 to 20 mmHg with the 10 kg weight loss, per 10 kg weight loss. DASH diet has been found to bring down the blood pressure by 8 to 14 mmHg, systolic blood pressure I'm talking about. Dietary sodium reduction brings about 2 to 8 mmHg, physical activity brings 4 to 9, and moderation of alcohol consumption has been found to be bringing down 2 to 4 mmHg. So these are the various antihypertensive drugs that are being given. Few drugs, they work in the vasomotor center, that is, they're working in the blood vessels, which is helping to relax the blood vessel, because if the blood vessels are constricted, then it is going to exert lot of pressure. You remember a pipe, okay? You just visualize a pipe full of water is there. Pipe is flowing. When the water is flowing through the pipe, it vibrates, isn't it? Why? Because the water is giving it is exerting the lateral pressure to the walls of the pipes. This is the normal phenomenon which is happening. It's a phenomenon of the fluid. It's a property of the fluid. It exerts a lateral pressure. Same thing happens to the arteries also. Now, if you're just compressing that pipe at one place, what will happen? It can rupture as well. And the pressure will increase. It will start vibrating like this because it wants to pass through. The fluid wants to pass through. Same thing happens here. And as a result, the drugs that are being given are to dilate the blood vessels. So there are few medicines that are being given, which works in the vasomotor center, that dilates the blood vessels. Then there is sympathetic ganglia, they work on it. Then there is medicines are there like which works on the beta receptors of the juxtaglomerular cells that releases renin. Not everybody is having hypertension due to the lifestyle or some, but few have got renin angiotensin aldosterone system issue, RAS. So for them, this angiotensin, this kidney, the beta receptors of the juxtaglomerular apparatus of your kidney, they release the renin. This renin converts the angiotensin 1 to angiotensin 2 with the effect of the angiotensin converting enzyme. And this angiotensin 2 basically increases the cardiac output. It increases the blood volume. Therein the ACE inhibitors are given. Angiotensin converting enzyme inhibitors are given. For those like propanolol. Propanolol is the medicine that is being given to those who have got, they're also known, and other beta blockers. They are the beta blockers because they are preventing the beta receptor to of the juxtaglomerular apparatus to release the renin. Also, we have the alpha receptors, or also known as alpha blockers, like the prazosin, which is working on the blood vessel. Then we have by having the angiotensin receptor of the vessels like losartan. You all are aware of this term. Losartan and other angiotensin receptor blockers, and beta receptors of heart that I already told you. So these are the dosages, these are the medicines. You are aware, many of you might be seeing. First of all, always check the prescription that what medication the patient is taking, because your medicines, they interact with the diet. So the drug diet interaction, if can be achieved, then the dietary efficiency can be, or the dietary efficacy can be achieved. Because whenever you take any medicine, and if you're taking some kind of diet with the nutrient which is going to interact with the composition of this medicine, then the medicine efficacy goes down. Okay, so medicine should never be taken with milk, first of all, any of the medicines, because milk interferes with the drug efficacy. So the class of drugs that are given in the hypertension is diuretics. Diuretics means like Ditor, that is the hydrochlorothiazides. Why? Because they releases the excess water from the body and brings the blood pressure under control. Beta blockers like atenolol, propanolol, calcium channel blockers like amlodipine, alpha blockers like prazosin, ACE inhibitors like ramipril, and angiotensin 2 receptor blockers like losartan. So these are the dosages that you just need to know for your knowledge, and not to prescribe anybody. You please do not go and prescribe anybody. So I already told you these things. So the side effects of the diuretics, if you see, they are like it causes hypokalemia, then it can cause hyponatremia, hyperlipidemia, those who are into Ditor 5, Ditor 10, that is the hydrochlorothiazide, please keep a check on their lipid profile because you probably have to alter their diet accordingly. And hyperuricemia, they can also develop the uric acid also. So the people who are having gout, the high uric acid are generally, this medicine is contraindicated. And then people who are diabetic, for them it can cause hyperglycemia, and it is not safe for the patients who are having renal disorders or hepatic disorders. Beta blockers are like these things. So I already told you what they do. The side effect include lethargy, impotency, bradycardia. You know what is bradycardia and the tachycardia? Rapid heartbeat is tachycardia, and very reduced heart rate is your bradycardia. And people who have asthma and diabetes, for them propanolol kind of drugs are not very suitable. They have also got an adverse effect on the lipid profile. Calcium channel blockers, they basically block the entry of calcium through the calcium channels. Thus, they cause vasodilation, and they reduce the peripheral resistance, means the resistance that is being given by the blood vessels. So, people, those who have coexisting asthma, for them the calcium channel blockers, amlodipine is a safer medicine rather than propanolol. But if the renin is high, then in that case, the propanolol is being given. Side effect include flushing, headache, pedal edema. If someone is taking prolonged dose of amlodipine, you check their feet, it is swollen. They take up, there is pedal edema. ACE inhibitors, they inhibit the angiotensin converting enzyme and formation of angiotensin 2 and block its effects. And drugs of choice in non-coexisting diabetes, if somebody is having, or heart failure. Side effect of giving this ACE inhibitors like enalapril, lisinopril, ramipril is the moment they lie down, or even if they are sitting, they are having a dry cough. Then it can bring down the blood pressure suddenly low. Hypertension. It can also cause angioedema. Edema can take place within the blood vessels. Angio means blood vessel. Angiotensin 2 receptor blockers like losartan. Okay, so they basically again inhibit the effect of angiotensin 2. So it is safer than ACEI, but it also causes hypotension. Alpha blockers, they block the alpha 1 receptors and they dilate the diameter of the blood vessel. So if the blood vessel constriction is being relieved with these alpha blockers, okay, but they also has been found to be causing postural hypotension. So these diuretics or these beta blockers, they have got certain side effects that I have already discussed. So accordingly, while planning their diet also needs to be seen. So these are the list of the names. I'll give this slide, I'll give this PPT to Dipanita. So she will share it with all of you, because it is going to be a kind of ready reckoner for all of you. Okay. So next is, what is the causes of resistant hypertension? If someone is not checking the blood pressure properly, if there is excess sodium intake, if the diuretic therapy is inadequate, and if the medication doses are not being proper, or if someone is taking illicit drugs, OCPs, if someone is taking, or NSAIDs like non-steroidal anti-inflammatory drugs, if someone is taking, like aspirin group of drugs, and if someone is taking the over-the-counter drugs and some herbal supplements, alcohol intake, if gets excess, then all these things can cause resistant hypertension. So the take-home message is, hypertension, it is a major cause of morbidity and mortality and definitely needs to be treated. Extremely common condition, however, it is still underdiagnosed and undertreated, and only way to diagnose is measurement. And hypertension is easy to diagnose and it is easy to treat, because if hypertension can be prevented, a lot of the diseases can be prevented. First of all, you can prevent the CKD and your cardiac arrest. And the aim of the management should be to save the target organ and the deleterious effect. And besides pharmacology, the prime importance, pharmacology should be secondary. The primary is the lifestyle modification, along with the, which includes sleep also. And the lifestyle modification should always be encouraged along with the diet for the hypertensive patients. So thank you. We have any questions? We are open to take that.
যাদের যা কোয়েশ্চেন আছে ম্যামকে করতে পারো চ্যাট বক্সে বা মিউট অন করে।
তাহলে আমি চ্যাট বক্সে দেখি যদি কিছু কোয়েশ্চেন্স থাকে।
ম্যাম আমার একটা কোয়েশ্চেন আছে, একটু বলে দিলে ভালো হয়।
হ্যাঁ দেবশ্রী বলো।
বলছি ওই যে স্লিপ অ্যাপনিয়া আর হাইপারটেনশন বলছিলেন, স্লিপ অ্যাপনিয়া থেকে হাইপারটেনশন মানে একটু কানেকশনটা কি, একটু যদি আমাকে আরেকবার বলে দেন।
আচ্ছা দেখো, স্লিপ অ্যাপনিয়া হলে পরে যেটা আমাদের মেজর প্রবলেমটা হয় সেটা হচ্ছে যে আমাদের হার্ট আর লাংস এরা তো খুব ক্লোজলি কাজ করে। এই হার্ট আর লাংস যখন আমাদের খুব ক্লোজলি কাজ করে, যখন স্লিপ অ্যাপনিয়া হয় তখন আমাদের লাংসও কিন্তু অ্যাডিকুয়েট অ্যামাউন্ট অফ অক্সিজেন পৌঁছায় না। আমরা তো ব্রিথ করা বন্ধ করে দিই। যাদের স্লিপ অ্যাপনিয়া আছে ওরা কিন্তু রাতে হঠাৎ করে ব্রিথ করা বন্ধ, মানে শোয়া শুলে পরে ব্রিথ করা বন্ধ করে দেয়। ঠিক আছে, তো সেইটা একটা সমস্যা আছে। এবং দেখা গেছে যাদের স্লিপ অ্যাপনিয়া আছে তাদের একটা হাই ব্লাড প্রেশার একটা রিস্ক ফ্যাক্টর হিসেবে সাথে সাথে চলছে। বিকজ আওয়ার হার্ট sends the oxygen deoxygenated blood to lungs and our lungs is sending back the oxygenated blood to heart. But during sleep apnea the lungs itself is not receiving the oxygenated blood. So then your heart it goes through a phase of ischemia also, lack of oxygen হয়ে যায় হার্টে। ঠিক আছে,
বুঝতে পেরেছি ম্যাম, ঠিক আছে, থ্যাংক ইউ।
অভিজিৎ দত্ত, হ্যাঁ
ম্যাম একটা কোশ্চেন ছিল ম্যাম, অনেকে ওবেসিটি যেরকম হাইপার টেনশনের সাথে রিলেটেড ম্যাম, বাট আন্ডারওয়েট পেশেন্টের তো ম্যাম অনেক সময় হাই ব্লাড প্রেশার বা ট্রাইগ্লিসারাইড লেভেল হাই
আমি তো
হয়ে যেতে পারে।
সেইটাই বললাম, আমি তো ডিউরিং মাই লেকচারই সেটা বললাম যে ওবেসিটিতে যেরকম একটা ব্যাপার, কিন্তু যারা লিন তাদের তো ওয়েট লস করার দরকার নেই। তখনই তো আমি ভিসারাল অ্যাডিপোসিটিটা বললাম। ভিসারাল অ্যাডিপোসিটি মানে কি, আমার পেটের অর্গানস এর মধ্যে আমাকে দেখতে রোগা কিন্তু আমার ভেতরে ইন্টারনাল অর্গানস, লিভারের মধ্যে ফ্যাট জমছে, প্যানক্রিয়াসে ফ্যাট জমছে, অ্যাবডোমিনাল ক্যাভিটির মধ্যে ফ্যাট জমেছে। যার জন্য কি হচ্ছে, আমার এই ফ্যাট গুলো স্পেশালি যখন অর্গানসে ফ্যাট চলে যায়, আমি এটা একটু বোঝাই তোমাদেরকে। যখন লিভারে যখন ফ্যাট জমে তখন কি হয়, এই ফ্যাটি লিভারের জন্য ইট রিলিজেস ফেটুইন এ এন্ড ফেটুইন বি, দুটো কম্পোনেন্ট রিলিজ করে। এই যে ফেটুইন বিটা যেটা রিলিজ করে ও আমাদের বডির ইনসুলিনকে কাজ করতে দেয় না। এবার ইনসুলিনকে কাজ না করতে দিলে ইনসুলিন কি করবে, ও তো রিলিজ করতেই থাকবে, ও তো গ্লুকোজ আমার ব্লাডেই থেকে যাবে, সেলের ভেতর ঢুকবে না, যে কারণে তো প্রি ডায়াবেটিস বেড়ে গেছে। তখন কি হয়, এই যে ইনসুলিনটা যেটা রয়েছে আমাদের, সেই ইনসুলিনটা আমার বডিতে ও আস্তে আস্তে হাইপার ইনসুলিনিমিয়া হতে থাকে, কারণ ইট ইজ গেটিং রেজিস্ট্যান্ট। ও রিসেপ্টরস যেগুলো বসে রয়েছে সেলের ভেতরে, গ্লুট4 বা ইনসুলিন রিসেপ্টরস, ও চিনতে পারছে না, যার ফলে ইনসুলিন রেজিস্ট্যান্স। এবার ইনসুলিন রেজিস্ট্যান্স হলে কি হচ্ছে, বডি তো বুঝতে পারছে না ইনসুলিন রেজিস্ট্যান্স, বডি ভাবছে বোধহয় সাফিসিয়েন্ট ইনসুলিন নেই, ও আরো ইনসুলিন তৈরি করছে, লিডিং টু হাইপার ইনসুলিনিমিয়া। যখন এত ইনসুলিন তৈরি হয়ে যায়, ইনসুলিন ইজ লিপোজেনিক ইন নেচার, ও নিজে লিপোজেনেসিস করে, প্রচুর মাত্রায় ট্রাইগ্লিসারাইড তৈরি করতে শুরু করে। তখন সেই ট্রাইগ্লিসারাইড গুলো কোথায় যাবে, অ্যাডিপোসাইটস এর ভেতরে যাবে তো, অথবা আর্টারিজ এর ভেতরে জমবে, জমে গিয়েও হাইপারটেনশন। ঠিক আছে, এই ভিসারাল অ্যাডিপোসিটির জন্যই আমাদের ব্লাড প্রেশারটা আরো বাড়ে।
Ma'am, how it leads to blindness?
When the blood pressure is high, do you think that it is only high in your brachial artery? It is high in all of your arteries. Say be it brachial artery, popliteal artery, dorsalis pedis artery, femoral artery, you talk about any arteries, carotid artery, everywhere, even your optic arteries যেগুলো রয়েছে আমাদের রেটিনা সেখানে অবধি। So if the blood pressure, if someone's blood pressure is so high which is felt in the big arteries, so imagine the amount of pressure that is getting mounted in these microcapillaries that are inside your eye, যার জন্য রাপচার হয়ে যায়, হয়ে গিয়ে ব্লাইন্ডনেস হয়ে যায়। অনেকের দেখবে ব্লাড প্রেসারে এত বেড়ে গেছে যে চোখের পাশে ব্লাড ক্লট হয়ে গেছে। ইট ক্যান লিড টু, যদি কর্নিয়ার ওখানটাতে হয় তাহলে ইট ক্যান লিড টু ব্লাইন্ডনেস অলসো। ঠিক আছে,
Okay, ma'am. Thank you.
ওয়েলকাম। Munaza has asked, ma'am, as you said, give salt-free breakfast, so can we include milk? Milk একটু milk দিতে পারো, বাট মিল্ক থেকে বেশি প্রেফার্ড হচ্ছে কার্ড। কার্ডটা দেওয়াটা অনেক বেটার, শরীরটাও ঠান্ডা রাখবে এবং কার্ডে তোমাদের সোডিয়াম কন্টেন্টটাও কম থাকে, তো কার্ডটা দেয়া যেতে পারে।
আরেকটা কোশ্চেন ছিল ম্যাম, কার্ডিওভাস্কুলার ডিজিজ বা পোস্ট অ্যাঞ্জিওপ্লাস্টি পেশেন্টের তো সোডিয়াম পটাশিয়াম লেভেলের একটা ডিসব্যালেন্স থেকে থাকে, তো সেই ক্ষেত্রে কি ম্যাম আমরা তো তখন তো পেশেন্টের হয়তো পটাশিয়াম বেশি থাকে, সেই ক্ষেত্রে আমরা পেশেন্টের মানে এরকম যেটা বললেন আপনি যে পটাশিয়াম রিচ ডায়েটটা দেওয়া উচিত ফর এইচটিএন পেশেন্টের জন্য, বাট এই অ্যাঞ্জিওপ্লাস্টি পেশেন্টের তো সেই সময় আমরা যদি পেশেন্টের পটাশিয়াম বেশি থাকে তো সেই সময় তো দেবো না আমরা, তখন তো
First of
সেইভাবে
all, in
মডারেট
case of the বুঝতে পেরেছি, first of all, in case of the angioplasty patient, potassium cannot be given if they are having hyperkalemia. Number one, angioplasty patient does not mean that they are going to have a high potassium level all through. There are a lot of stent cases who are leading a normal life. Okay, so for them, if the potassium is high, if there is hyperkalemia, then potassium to be restricted. Number one. Number two, they should not have a high potassium diet, but they can have a moderate diet, which is having normal fruits, vegetables, that's all. Because most importantly, these patients are also given K-bind, which is given to bring down their this potassium level. And also they have got a sodium disbalance also, as you very correctly mentioned. The sodium level is also high. So accordingly, the sodium reducing drugs are also being given, diuretics are given, so that the sodium can also go out of the system. So that is how it is being maintained. Do not increase the potassium in their diet, because those who are having angioplasty cases, they can have a moderate diet with the whatever they're getting through the food if their potassium is not elevated. But if the potassium is elevated, then the doctors, they themselves give the K-bind. K-bind is given. And other potassium binders are being given.
ম্যাম, একটা কথা বলা হয় কি যে হাইপারটেনশনের ক্ষেত্রে স্পেশালি ওষুধ শুরু করলে ওটার মানে অফ করা যায় না, মানে ওটা সবসময়ই কন্টিনিউ করতে হয়। তো এটা কিভাবে, কারোর যদি প্রেসারটা কন্ট্রোলে হয়ে যায় এই ইয়োগা বা ডায়েট মেনটেন করে, বা হয়তো যেটা প্রি হাইপারটেনশন কন্ডিশনে থেকে গেল, তো সেক্ষেত্রেও কি আমরা মেডিসিনটা কন্টিনিউ করব?
Momita, to answer your query, first of all, I'm telling it in English because there are few people who are finding it difficult if I'm giving the reply in Bengali. So first of all, are you sure that what is the cause of the hypertension? Firstly, even if they're at the pre-hypertensive stage, the cause of the hypertension is very important, because if it is due to the renin-angiotensin mechanism, then other than taking the medication, there is no other way, because your kidneys are not producing renin. That is not associated with the lifestyle. Hypertension, which is associated with the lifestyle, can definitely be treated that way. But once there is hypertension, once there is diabetes, there is nothing called reversal. Reversal is a vague term. It is your remission. Remission takes can be there. But with that, you need to keep a close check, and then you can go ahead. But if someone is having hypertension due to RA, that is the renin-angiotensin, for them, medication is the solution. Without medicine, their kidney will again start. Or if someone is having aldosterone hormone issue. So if the issues are hormonal, if the issues are such, then in that case, without giving medicine, you cannot control the blood pressure. So it has to be given and it has to be continued. Probably the dosages can be adjusted by improving the lifestyle, but it should not be stopped. Because hypertension is a silent killer disease. It will not even say anything and suddenly there can be a cardiac arrest. It can take place.
ওকে ম্যাম, থ্যাংক ইউ ম্যাম।
Welcome. Ishita has asked, banana contains good amount of calories. Ota kono problem create korbe ki patient jara obese? No. Obese patient can very easily take banana because they are so feeling. One banana itself is enough to curb your appetite. So why not? One banana is giving you 23 grams of fiber. So it is so high fiber, it is fiber dense. Moreover, it is having fructose, which is, who said that an obese or an obese person do not need fructose or glucose? We also need carbohydrate. But if I'm giving carbohydrate from a healthier choices, why not? They can have. All my obese patients, they take banana, they are reducing weight also. My obese patients, they take a potato also, still they are reducing weight. It is about how you are adjusting the calories. It is about how you are making them do the workout. Okay. So it is not just one factor, but it is the 360-degree approach that has to be taken.
Okay, any other query from anyone? I think no. Okay, thank you so much, ma'am.
Thank you.
It is a very informative and awesome seminar. Really, I enjoy very much. Thank you, ma'am.
Thank you so much. Thank you so much. I mean, it was indeed a pleasure to be amongst all of you. So I actually thank to Dipanita for bringing me here, because even I also enjoyed. You guys were quite interacting and asking questions, because no questions are silly questions. I always say this. We should always ask, because without asking, we won't be able to know what exactly is happening, right? So we need to know more. We should definitely keep on asking. Thank you so much for all of your kind feedback. It really means a lot to me.
Thank you so much, ma'am. তাহলে এখানে ক্লোজ করলাম। Good night.
Okay, thank you. Good night.
Night, everyone.
Good night. Mm.